Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're going to speak about how the hygiene department can improve. And about 50% of my phone calls are all about the hygiene department. First off, we're going to speak about Parkinson's law. Parkinson's law is this, is that a task will expand to the time that is available. Think of it this way. You're going to go visit a friend. You have about an hour's time, but you're hoping to visit them in about 30 to 40 minutes. But the task, the item that you're going to do expands to that hour. It also can be true in restorative treatment or in a cleaning. If we have that extra time available, we expand the task to fill that time. So with the hygiene department, we have to be very guarded on our time and treat our time very carefully. So the first 20 minutes, we've heard the rule of 20-20-20 of using our time for the first for diagnosis, the second part for scaling, and the last part for the exam and questions that the patient might have regarding treatment and cleanup. So let's focus first on the first 20 minutes. On the first 20 minutes, we need to go over the health history. If we do an oral health scan or any intraoral pictures, any x-rays or a full mouth probe, go over all those things in detail and find out what the patient needs. Because if we start out understanding and diagnosing where the patient is, we're going to be better clinicians. Now, some hygienists struggle with the oral health scan or being fast at the x-rays. Use your dental assistants. Have them teach you how they go about taking their x-rays and doing the oral health scan, because they have a lot of information and they are very fast, and I'm still learning from them. They teach me how I've learned and gotten my time down with my oral health scan from being around 8 to 10 minutes. I'm down to 6. So I've gotten better because they've taught me some techniques that I didn't know. So learn from your dental assistants. They might have some great techniques for you. So use that first 20 minutes for diagnosing, and then the next 20 minutes is for scaling. Now, sometimes patients need more, that they need more time for scaling. And what often happens is the hygienist either runs late or we end up leaving calculus material behind. But is what we need to understand is that we need to be our patient's advocate. If our patients have more buildup in calculus and we can't get it off in 20 minutes, the patient may need more. Sometimes we get stuck and feel like the patient can come in only every 6 months. But we want to keep patients from disease. We want to keep patients healthy. And when we speak to patients about the oral systemic link and that the benefit of keeping them in health and the benefit of keeping their teeth, patients will say yes, and they're more likely to say yes when we speak about the benefit. Let them know that we care about them, and we need to remove that barrier that we have as a hygienist of the finances and of the time. And let the patient know, I want you to keep your teeth for the rest of your life. Is this your goal also? And then look at their health history. Do they have diabetes? Are they a smoker? Do they have a family history of periodontal disease? What's going on in their life that will help them so they're more interested in maintaining their health? Because that's what we want to do. We want our patients to be healthy and have their teeth for the rest of their life. So be their advocate. Start with the benefit and let them know what their options are. People love to choose. Now, as I spoke about, use your dental assistant, have them teach you things, but also help the dental assistant. Too often there's a separation of church and state, if you will, of the restorative side and the hygiene department. If you're leaning on the assistants and having them help you, be willing to give them anesthetic if you can give anesthetic in your state. Or if they're running behind, be willing to seat their patient or help turn over a room. Be willing to help, because when we work together as a team, we are so much more powerful. Another thing I like to do is I like to have a clock in my room. And is why I like to do that is it helps me to stay on task, but it helps me to check to see how I'm doing. Because one thing I know is if I haven't started polishing by 40 minutes into the appointment, I'm in trouble. I'm going to be behind. And so that helps me to check myself, because more than anything, I want to be there for the patient, but I also want to be on time for the next patient. So find the right wording that works for you and for your patients to explain treatment, to explain how they need additional treatment related to the oral systemic link. Educate your patients, because when patients understand, they are more likely to say yes and to stay healthy. I appreciate you spending time with me. Have a wonderful day.